Well, September is Prostate Cancer Awareness Month, and this month there is new hope about the potential of immunotherapy for African American men who are increased or at increased risk of developing this disease. Dr. Benjamin Lowentritt joins us now from Chesapeake Urology. Thank you for being with us.
Thanks so much for having me.
So I want to jump right into this. I want to know how many men get prostate cancer each year, and are there certain groups of men that are more affected by it?
Absolutely. We know that this year it's anticipated that about 190,000 men are going to get diagnosed with prostate cancer.
Mm-hmm.
It's far and away the most commonly diagnosed cancer among men in general. But we also know that it's about a 50 to 60% increased risk in the African American population. That's something we've known about for a long time. There's also an increased risk if you know that you have a family member with prostate cancer. And now newer information that even family risks of other cancers like breast cancer might increase the risk overall of having prostate cancer for men.
So what can you tell us about the use of immunotherapy for prostate cancer specifically?
Yeah, immunotherapy in general just means any treatment that allows the immune system to kick in to fight the cancer. The immune system is supposed to be the first defense against prostate cancer or against any cancer. So any therapy that's trying to re-engage that system is called immunotherapy. And the most exciting thing in prostate cancer is for the last number of years, we've had a very specific individualized immunotherapy that almost acts as a vaccine to try to fight the cancer in that man. So it is only indicated in men that have a more advanced form of prostate cancer where the cancer has already spread and stopped responding to some of our first line treatments. So these tend to be patients that frankly are very likely to die of their cancer, but hopefully we can continue to control it and turn the cancer into more of a chronic illness as opposed to a lethal disease. So the exciting news is that in looking at some of these patients that have been on immunotherapy, we're learning more and more about people that respond best.
And there was a new registry study as well. So tell us about the possible benefits of the immunotherapy for African Americans, especially compared to Caucasians that are experiencing this treatment as well.
Absolutely. So the treatment itself has been around now for about 10 years. So it's not brand new, but this registry trial looked at men that received the treatment over about a 4-year period and then followed them to see how they did. And what was really remarkable is that we saw all men seem to get a benefit from this. That's been proven. But when really looking at some of the different sets, African American men had a almost 2-year benefit over Caucasians with the same otherwise similar looking profile. So it was about a 20-month additional survival benefit compared to the Caucasian group. So that's 2.5 years versus 4.5 years in looking at the African American men survived on average of 44.5 years compared to 2.5 years in Caucasian men. So really a significant difference. And for a disease that we know affects African Americans more and a disease that more African American men die on a percentage basis than Caucasian men that have prostate cancer, it's really remarkable to be able to find a treatment that seems to differentially benefit as well.
And are there common side effects of this treatment that people should be aware of as well?
What's really wonderful about this, and I mentioned the word vaccine before, some of the side effects are really very similar to what someone might expect from a vaccine or maybe from a blood transfusion. People can get some shakes or chills that are very short-lived just when they're receiving the treatment, or possibly a headache for a day or two. It's really fairly minimal, thankfully. There are always side effects that we have to monitor for with respect to other problems long-term, but really very minimal side effects of this.
So where can people go to get more information about this, and specifically your practice? Because I'm sure that many of our viewers are going to be watching and thinking this is the type of information that we need.
Absolutely. So you can go to www.chesapeakeurology.com or certainly call the office at 410-825-5454. We have offices all around the Baltimore area, and we offer this treatment in multiple places around Maryland. So we'd love to help anyone that's interested.
All right, Dr. Lowentritt, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.